What is sexual satisfaction? What is the level of sexual satisfaction among married women in Ethiopia? Below are evidences from Betriger's ZGI study. Satisfaction with one's marriage or relationship tends to be crucial in overall happiness. Marital relationship is influenced by various factors, of which, sexual satisfaction is mentioned to be one of the most important contributing factors. Sexual satisfaction is a very personalized feeling, powerfully related to previous sexual practices, existing anticipations, and upcoming ambitions. Lawrence and Byers define sexual satisfaction as an emotional response to a subjective evaluation of positive and negative aspects related to sexual life. It is a key factor in individual sexual health and overall life satisfaction. Moreover, having a satisfactory sexual life is the basis of a happy marriage and family, being an essential component of health-related quality of life. Sexual dissatisfaction is one of the causes of divorce and connection difficulties between couples, and it is considered to be one of the most significant factors affecting women's health. Globally, sexual dissatisfaction is a more frequent problem in women as compared to men. A study showed that 15% to 50% of women are not satisfied with their sexual activity, and 50% of divorces between couples are mainly due to sexual dissatisfaction. Sexual dissatisfaction is also a common problem of African women. Studies conducted in Nigeria and Ghana reported that only less than half of the women, 45.8% and 34% respectively, had pleasurable sexual activity. A number of factors could be associated with sexual satisfaction. For example, higher educational status, better state of physical and psychological health, higher socioeconomic status and good relationships with the family have been associated with high sexual satisfaction. Similarly, sufficient sexual information, high partners relationship, small age difference between couples, good sexual functioning and social support have been associated with greater sexual satisfaction. Some studies have found a relationship between drug addiction and less sexual satisfaction. Other factors that could influence sexual satisfaction is religiosity. Low religious belief has been associated with greater sexual satisfaction. However, a study has found no difference in sexual satisfaction between religious and non-religious couples. Sexuality is an important aspect of quality of life that is often neglected in research studies. Because of social customs and culture, clients and their clinicians often avoid discussing about sexual satisfaction. Community-based studies on sexual satisfaction and associated factors are almost lacking in Ethiopia. Hence, the epidemiology of sexual satisfaction in Ethiopian women is largely unknown. Understanding the sexual satisfaction and its associated factors would facilitate efforts to promote the quality of life among Ethiopian women. Hence, this study was undertaken to investigate the sexual satisfaction and its associated factors among married women. Regarding methods, community-based cross-sectional study with mixed approach was conducted from March 1 to April 30, 2019 in Kiwat District, northern Ethiopia on a sample of 397 married women. Quantitative data was collected on a face-to-face interview using a pre-tested questionnaire while qualitative data was collected using in-depth interviews. The new sexual satisfaction scale was used to assess sexual satisfaction of the women. Descriptive statistics and ordinal logistic regression analysis were performed using SPSS version 23. In conclusion, this study has shown that the majority of the participants expressed moderate sexual satisfaction rate. Several factors have been identified to influence sexual satisfaction of married women: previous information about sexuality, sexual function, sexual self-esteem, partner communication, perception of sexual talk as taboo and social responsibility. Hence, sexual information before marriage that could be achieved by providing sexual education is very important to improve the couple's sexual satisfaction, thereby preventing emotional distress and relationship problems. Further, large-scale studies with more diverse samples are needed to elucidate the impact of other factors on sexual satisfaction.